Welcome to the Neurostimulation Podcast. I'm Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia in Vancouver, Canada. The Neurostimulation Podcast is all about exploring the world of neuroscience and neurostimulation, how it works, the latest research breakthroughs, and how that research is being translated into real-world treatments that can improve health and well-being. This podcast is separate from my clinical and academic roles and is part of my personal effort to bring neuroscience education to the general public. Accordingly, I would like to emphasize that the information shared here is for educational purposes only and is not intended as medical advice or a substitute for professional medical guidance. Today's episode is presented by ZipStim Neurostimulation. ZipStim is the neurostimulation clinic that I operate. You can find out more about our clinical neurostimulation programs at zipstim.com. That's ZIPSTIM.com. Today, I'm really looking forward to a discussion with Dr. Jessica Tighe. Dr. Tighe has a PhD in psychology, and she has a wealth of experience and expertise in coaching and leadership for high-performing individuals, particularly in the healthcare sector. We are looking forward to a really interesting and fruitful discussion with lots of tips and strategies on stress management and optimal management of team environments in challenging kinds of industries like healthcare, where there are always resource limitations and people are constantly trying to do more with less. So stay tuned for the conversation. I'm really looking forward to it. It's going to be enlightening, interesting, and useful. Welcome back to the Neurostimulation Podcast. Today, I'm really excited to be joined by someone who brings a wealth of experience, wisdom, and heart to the conversation around healthcare leadership and well-being. Dr. Jessica Tighe is a dynamic executive coach with a PhD in psychology and over 2 decades of leadership experience in healthcare and mental health. Dr. Tighe, thanks so much for joining me today.
Thanks so much for having me.
Yeah, I'm really looking forward to today's conversation. I'm curious, maybe we can start, you can help listeners and viewers understand a bit more about your journey. Tell us what inspired you to move from executive roles in healthcare to becoming a coach and an advocate for sustainable success and well-being.
Yeah, sure. As you said, I have a PhD in psychology. I worked in mental health for many years in my early career and then transitioned over to healthcare and administrative roles. And I always knew I wanted to work with people again at some point. And so I got to that point, and when I wanted to start my own business, so I decided to put my skills together, and now that's what I do when I work with individual clients and also business to help them create cohesive teams. I teach them how to combat burnout and inoculate themselves and their teams against burnout and stress, and really help them through specific issues as they come up.
Yeah, that's really interesting and so valuable. And I have a lot of experience personally in the healthcare industry on the provider side, as well as on the consumer side. It's really clear that because of all of the challenges in terms of delivering healthcare, obviously budgetary challenges and resource challenges on the provider side and on the administrative side, which of course leads to emotional challenges for caregivers, notwithstanding even just the stress associated with providing care, but having times when there are resource limitations that make it difficult to provide perhaps the best care possible, although of course we all do our best, but also on the consumer side, feeling obviously emotionally under a lot of stress. Let's maybe if we could just touch on your experience in helping healthcare professionals who may be feeling frustrated or stuck trying to do their best within a system that doesn't always respond in the ways that we might hope. What would be some common challenges that you're seeing in your work with healthcare leaders these days?
Oh, yeah, that's a very broad question. I'll try to be succinct, but yeah, healthcare has always been do more with less. And there's a culture of all you need to do is work harder, faster, longer. And that the human beings just aren't built to do that. Not the people providing care and also not the people receiving it. They don't want to be on the receiving end of a doctor who's just flying by and spending 3 minutes with them instead of the 30 to unpack their situation. Nobody wants to feel that way. So it is still a huge challenge. And even though there's been some changes, I think, in the healthcare industry in terms of putting patients more first and more at the forefront, there's still a lot of work to do in that area. But I think a lot of leaders today they're facing a lot of challenges. The investor world has really come into our industry. Companies are being bought and sold in a way that we've never had to deal with before. All of a sudden we have new ownership. All of a sudden you have a restructure and new CEOs, and that's happening at a pace that I don't think any of us are comfortable with. So that's something huge that the people that I work with talk about a lot. It's a huge challenge and one that we didn't really anticipate. And then also just work with a lot of people in the senior living space. And so just the challenges of more and more seniors needing care, people that are caught in that sandwich generation where they're caring for their parents and also caring for children at the same time. And how do you do that? And how do you balance that? And what does that look like? I think those are the main challenges that I hear a lot from clients and people that are, when I do a workshop or when I'm speaking, those are the questions that I get is how do you manage those things?
Yeah, that makes total sense. And it's so true what you say about the sandwich generation. Again, personally, I've experienced a lot of friends who are in my age range are struggling with similar kinds of challenges. It's really interesting, actually. You may not be aware that I'm primarily a geriatric psychiatrist in terms of looking after folks in later life. So one of the care facilities that I go to, I was just there last week, and I noticed, so it's long-term care facilities as often have large buildings, a lot of space in which to provide the care that they do for their seniors living there. And this facility in particular is blessed to have a lot of extra space. So they really came up with a super initiative that I just saw in fruition, and it looked fantastic in that they started a daycare in the long-term care facility. So there's so many positive benefits to that, not only for the staff maybe who need childcare or for family members whose loved ones are the seniors in long-term care and need the childcare, but just to have the kids nearby where the seniors are living and to provide that sense of community and like a village, like perhaps the way things used to be in times gone by.
That's wonderful to see. I wish there were more examples of that here in the US because it used to be grandparents were the ones that took care of the small children while mom and dad were working or taking care of the house. That's how we grew up in my day and in previous generations. And you have that. I think that's really cool.
Yeah, it was quite heartening to see, really. Hopefully that sparks a trend. We can start to see more of that. Even short of that, it's been fairly common for care facilities to have programs where they'll bring, elementary school, primary school age kids in for programs, and that way they can provide some company for the seniors, and then it's an experience for the kids as well to provide almost like a surrogate grandparent-grandchild relationship, even if it's just for an hour or two. So that kind of thing even would be helpful along those lines. But maybe we're going off course a tiny bit here. I was curious though, just in terms of your own work with this kind of thing you're describing in terms of supporting caregivers, supporting administrators in healthcare as far as leadership is concerned, what would you say, I guess, of course, as you say, making do with less, trying to do more with less is a constant refrain that we all hear. And I think for me, a term like sustainability, I know it's maybe overused in general these days, but I think it is relevant in terms of this conversation. So what would be a realistic definition from your perspective in terms of something like sustainable success for the healthcare professionals, given the high stress roles involved with the work itself, as well as other considerations like family time and childcare?
Yeah, good question. What I focus on with people in the healthcare space, I think that just the way that we're built, we do care, we get part of our intrinsic motivation is to give more than we receive. That's just our constitution. That's how we get rewarded. But we can so easily cross that line into giving away more energy than we really are able to. And then all of a sudden we're channeling too much energy into our work, and regular rewards are not enough to compensate us energetically for what we're giving out. And it's that psychology, there's a term called behavioral drift. There's these little allowances, and then before you know it, you're way off course, such as, oh, I'll just check my email while I'm drinking my coffee in the morning, or I'll just stay late to do these last 5 things, or I'll just work a little bit on Sunday so that Monday's not so crazy. And then before you know it, you're working 60 hours a week and you have no idea how it happened. And I think a lot of leaders and healthcare professionals find themselves in that spot, and then they have absolutely no idea how to get back. And so that's what I do, is I really diagnose and do an autopsy of their day and see, all right, where are those allowances that you did? And what happens when we just experiment with, why don't you just stop checking your email in the morning and just leave those last tasks at the end of the day? And what will happen? And will the world fall apart? Of course not. But they really have to see those experiments come about while they really work to make more time for themselves and make more time for their families. And then energetically, they really need to see that they can have more energy for themselves and have more energy for their families and their children. Because that's also a problem, is that even though they're present at home physically, they're not really present mentally, or they're not mindful with their families, and guilt and shame creep in. And so we really have to unpack those emotions too, and really work with those, settle some of those things and settle some of those anxieties so that they can move forward in an effective way, in a way that makes sense for them. So that's what's sustainable for me, and what balance really means for me and my clients, I think.
Yeah. Thanks for explaining that. That also makes perfect sense. It's something that I can really see how these subtle kinds of intrusions into home life and family life and personal life can end up. It's a bit of a double-edged sword, because our institution, like the main acute care hospital where I work, that network of hospitals instituted a long overdue electronic medical system, probably 4 or 5 years ago. The electronic medical system now that the hospital runs on has really improved efficiency in many respects. And it's also nice to be able to log on remotely from home and look at charts and update notes, and even on call, maybe just if an urgent order needs to be adjusted before you can actually go in and see someone, it allows for that. So there are benefits. But then again, as you say, should you really be logging in to the hospital system remotely and doing work when maybe before you weren't able to, and so by default that you were more present at home and devoting that quality time to spending with family or self-care. So it is a bit of a double-edged sword. In some sense, the old way it used to be, maybe people would just stay at work longer and not be seen at home as much. So you could argue it in some sense both ways as to what's better. But as you say, I guess with coaching people, it's really important for them to just be aware of it and to have some sort of strategy for trying to manage and balance as best as one can.
Yeah. We talk a lot in my work, we talk a lot about those boundaries, because when these electronic systems were implemented, there was a training on the system itself, but there wasn't a training on how to utilize it in necessarily your daily life, or what should be the boundaries around a system like that. What should be the boundaries around your on-call work? And, what does constitute an emergency? Obviously, in healthcare, it's a 24/7 beast. And so of course, you're adjusting med orders. Of course, you're reacting to emergencies as they come up. And those kinds of things are common. But it's also a situation where you can really work as long as you want to, or as long as you need to. And then it just crosses that line where all of a sudden the job's working, you're not working the job. And it's finding out where those lines are, and actually putting some succinct boundaries around your time and also your energy, and making sure that people feel like they are getting appropriate rest the Olympics this last summer. And I loved seeing a lot of interviews with athletes because they were talking about rest and recovery being just as important as the training. We don't do that for ourselves in our daily lives, and we really need to. So we need to build in rest and recovery. And it's amazing when you see top leadership actually put that in as an expectation for their employees. And it's really great to see that transformation and see how cultures can transform. And they actually name it as something that's just as important as what's going on in their work hours.
Yeah.
Yeah.
For sure. Yeah. And I think one of the things you said just now, which really resonated, is that I think part of what it is probably, I wonder, and maybe you can tell us if you agree with this or not, but I wonder if part of the issue, part of the root of the issue is that high performing individuals, particularly people who go into healthcare, probably by predisposition in terms of character and personality, it would make sense that would be scoring high, say on an OCEAN type personality test. They'd probably be scoring high on things like conscientiousness and industriousness and also agreeableness. So I would wonder if those three things in particular would make it so that someone would really feel, because of being conscientious, industrious, and agreeable, inclined to overextend in terms of giving, and then maybe start feeling overwhelmed and then resentful and bitter, and then maybe concepts like compassion fatigue. Again, I know I've certainly experienced that to an extent, as have a lot of my colleagues. Compassion fatigue can set in, and then you're at work and you're grouchy. Maybe there's some tension with colleagues, and then sometimes that can even unfortunately spill over into interactions with patients and their family members. So that can be a real thing for people to need to know about, and to try and maybe understand that the importance of the self-care piece is so that you really don't get to that point, because in the end, then that's going to compromise your ability to be the best person that you can be at work.
Yeah, absolutely. That's well put. You do have to take care of yourself so that you can take care of others. In terms of personality, a lot of my clients that I work with do struggle with some type of people-pleasing kind of behavior. And I like to say a character defect is just an asset that crosses the line. Like that agreeableness, that conscientiousness, that's wonderful. It makes them a great employee. It makes them a great leader and a servant leader, which of course we want to see. But then it crosses the line into a character defect when they're people pleasing, when they're not setting boundaries, they're not taking care of themselves in an effective way. And then they're having these symptoms of burnout, which is like anger and resentment. They're channeling too much energy into their work and they're not getting enough back. And they're thinking negatively about their work instead of really remembering why they were there in the first place. So it's about figuring out what those boundaries are and what it means for them, and working through some of those emotional edges that we all have so that they don't repeat that behavior going forward.
Yeah, for sure. That's super helpful. I think, the awareness is the first piece, and also probably wreck a lot of stuff when people are in need of professional support and counseling. It's that you're not alone, and it's a very common issue. But I think probably increasingly talked about internally, but there's still that kind of stigma, like, oh, I guess it goes along with what we were just saying in terms of the average personality style, is that this is something that I should be able to deal with on my own or what have you, and that sort of stiff upper lip mentality. Maybe, I know obviously your work is very specific and individual with clients, but do you have a few perhaps practical strategies that you would typically recommend, say, when you're introducing the concept of, first, as we were just saying, understanding the importance of identifying those areas that you're wanting to target as perhaps requiring some change, and then how to recommend that people protect their well-being by putting some clear sorts of red lines around the healthy boundaries that would be important for that sustainability?
Yeah. So I have when I work with people, I have a whole leadership module. So I work with people who have teams of 2, all the way up who people have teams of 100 people. So I love to work with all sorts of different leaders and all across the spectrum. But what we do in those leadership modules is really look at what those boundaries are. We operationalize them for themselves and their teams. And there's communication strategies and boundaries around work-life balance, that not only are they sharing what their own boundaries are, but they're also making sure that their teams know what their boundaries are, and then making them do the same exercises. So it's really important that the entire team or an entire staff is coming along with you on that journey, and recognizing that, hey, we're going to all make rest and recovery a part of our daily life. So that's part of it. And then individually, I work with people. Just as an example, one of the first things that I usually do with a client is I recommend dopamine detox. And it's a buzzword right now, but it's letting your brain be bored for a period of time. And it's a personal practice that I have. And it's being bored. It's not getting on the internet. It's putting the phone down. It's not getting on TV. It's just letting yourself be bored and alone with your thoughts for a period of time. People don't know how to do that in this online world. We've just lost that skill set, but it really is so important to just let your brain actually rest, and for people to learn what it feels like for your brain to actually rest and recover. There's other exercises too, but that's one that has a really huge effect for people that practice. And there's videos on YouTube and things like that are really helpful, and there's supports. You can do this yourself for your listeners, but it's incredibly effective. And so I think that's a way that people can rest. And it's not just sitting there watching Netflix and playing a word game on your phone. That's not exactly rest. Rest can take many forms, and we just find what works individually for my clients.
Yeah, that makes a lot of sense for sure. I think that brings in an aspect of mindfulness without it seeming overly spiritual, whatever. There's the mindfulness, but targeted. The idea that attention is so precious that you have to be intentional in a healthy way about how you're directing your attention. And I think something that comes to mind, a personal experience just in terms of figuring out where the boundaries are and just discussing with colleagues, has to do with something like etiquette around use of email versus text message for, say, within a team. There was a while where, again, during a bit of a transition, some of us my age are more used to email maybe, and not so used to the text messaging thing, which, although is very useful, can lead to some spillover again, right? And so getting the text at 6:30 and 7 a.m. that maybe could have been sent by email required some sort of just careful collaboration and saying, can we just figure out what are going to be our parameters around sending text? So yeah, little things like that, but that you have to acknowledge that, okay, how am I feeling about getting, say, an early text message or some other sort of maybe small boundary violation? Is it something that I'm going to just blow off and say, oh, maybe I need to suck it up? Or is it something that I'm going to acknowledge as upsetting in some sense and in need of more broader conversation? Because maybe I'm not the only one that's upset by an early text message.
Mm-hmm. Yeah. And I think that those conversations are very important to have with your team. Like I'm a Gen Xer, so I feel very similar about email. I love email. I can check it whenever I want. I have to physically log in. I don't have notifications on my phone. And that's just my boundary around it. But with my team, I know I had to really operationalize it because I was on call 24/7 as well. And I had to say, all right, my response hours are 7 a.m. to 7 p.m. And so they knew they could send me a text message at 6 a.m., but I'm probably not going to respond. Or if I did, it was my choice. And then 7 p.m. to 7 a.m. that's an emergency. And that is an actual phone call. You have to call me, and it has to be an actual emergency, and you have to follow the emergency on-call procedure. Because especially when you're on call and you're in a leadership role, you'll get weird wonky calls at 1 o'clock or 2 in the morning that aren't actual emergencies. And you've got to set boundaries around that. And it's okay. I think we've fallen into people that are servant leaders, I hear it a lot where they're like rather than call me than not call me. I'm like, those aren't the only two options. We can actually change this behavior a little bit so that everybody understands what it actually looks like. And for younger folks, I had to implement they were used to calling, but not leaving a message. And I'm like, no, you have to leave me a message if you want a call back. I'm not just going to get a random phone call from a random number. I'm not going to just call you back. But some people in Gen Z, that's what they're used to. You get random phone calls and then you just call the person back. And I'm like, no, I'm not going to play that. I want an actual voice message that tells me why you're calling. And it's okay to set those boundaries with your team. It's okay to set those communication protocols in place. And it does make it makes everybody, I think, feel a little bit better and more cohesive versus learning those things over time. What I do with leaders is operationalize some of these things so that everybody knows day one, this is how I work and this is how I like to communicate, versus leaving it just to having a relationship over time. We don't have the luxury of doing that anymore.
Yeah, for sure. For sure. Even I think small things that end up being big things, like one of the things I try to adhere to is not, first of all, just as you said, just inviting a phone call. I think that having this just a live interaction, if it's within those boundaries of when you're available, I think I found that's really important. And because the things when they're written can be taken out of context, I try not to have a pretty solid rule of not really putting anything negative into any kind of written communication, because people are hardwired to be more sort of risk averse. So perhaps it's more likely that someone's going to misinterpret it even more so on the negative side than was intended, whereas that can really be couched in the emotional tone of what you're saying, if it's over the phone or if it's an in-person, just how your body language and facial expression contextualizes the feedback. So that's a little something that I try to do in my interactions with team members that I've found to be quite helpful to minimize any kind of misunderstanding.
Yeah, there's a lot of research around this now with email and also text communication. There's a lot of research about how, as humans, for whatever reason, we are more apt to misinterpret tone or comma placement or grammar, and we automatically go to the negative. So it's good to be aware of that. And so for yourself and your listeners to not read into things. But also it's making sure that we are having that voice communication when we do want to get across something with our tone and our voice, making sure that we're still doing those things. So just so that there's not that miscommunication, because it is so easy over email. Like commas matter. Totally. Let's eat grandma. Oh, let's eat grandma.
Yeah. Definitely. Yeah, for sure. Or even I find it funny, I sometimes go back to emails that I've just written and I think, okay, do I really need all of these exclamation marks? It's if you don't have it, then you're just like talking in a very flat, disinterested kind of tone. But on the other hand, if you have too many, it's almost like overly excited about something pretty mundane, right?
Yeah. And there's a difference between men and women. Women will use more explanation points. There's a lot of research around that where men don't. And it's because we want to come across as more positive. We want to make sure, hey, this is a positive message, and we want to appear and please the other person. So yeah. Sidebar, but there's a lot of research around the way that email and text communication happens between genders, between generations. It's pretty fascinating now that we have this huge body of research around it, just to be aware of that.
Yeah, for sure. How about in terms of things like in your work, I understand that you're focusing in on building, and it makes total sense, teams that are cohesive, that are just functioning as well-oiled machines. I'm curious then, what would be maybe one or a few underrated leadership skills? You've mentioned servant leadership, but what would be some underrated leadership skills that really help build team trust and resilience?
Oh gosh, that's a big question. There's a lot that goes into it. I think that I know this just happened with a client today. I was working with a new client on, for example, they're not having monthly meetings with their team members. They're not having monthly trainings. And they're like, I don't like meetings and no one likes meetings. I'm like, but it's a safe space for people to raise concerns and ask questions, and everybody gets the same training and gets on on the same page. So I actually think there's a balance between not having too many meetings that could have been an email. There's that old joke. Also, you have to have something. You have to have a space so that people can learn together, but also get the same information, and then you can tell them how you want them to assimilate that information. And I think that's really important to do in groups. This particular leader that I'm working with, she's great and doing a lot of things right, but she's managing through text and managing through these one-off conversations because she has and she's not averse to meetings. It's just that she thinks everybody is. And so it's getting her to see that a little bit differently, and getting her to see that if you're just having these one-off conversations and like managing through text, that's just not going to be as effective as creating a cohesive, safe space for people to come together and also talk about their own emotions and concerns. And especially in healthcare, we're talking about things that are hard. We're talking about people that, the patients that we care about and residents that we care about, and people passing away and how that affects us, and talking about compassion fatigue and getting training on some of these things that we need in order to just do our daily jobs. It's so important. So I think creating those safe spaces and creating opportunities for staff and other people to come to you as a leader, so that they can get their needs met emotionally. I think that's so important. It's figuring out what that looks like within someone's particular organization. For her, that was eye-opening. Oh, not everybody hates meetings. Okay, great. I think I'll schedule one. So we're going to try that with her. That's just an example.
Yeah, it makes a lot of sense. Yeah, in some way, again, it's a whole balancing act. I can see on the one hand how maybe adding meetings isn't what everyone's thrilled about. But on the other hand, there's something about it, particularly in-person meetings, that again, you can pick up on dynamics of what, people are like in terms of engagement, what they say, what they don't say, little things like that are even more difficult in this type of thing with more people that are doing Zoom meetings. And it strikes me that even having informal meetings, trying as much as possible to have lunches together and other sorts of conferences, getting together and just having more time together socially, but maybe not exactly devoted to specific work agenda related items, it could be part of the solution as well.
Yeah. And as another example of that, when I ran my leadership meetings, and I give this to my clients, there's a particular way that I ran my leadership meetings, and some of the action items that came out of those meetings were about how to support each other. So there was actually a check-in to say, hey, I'm having a hard time. I had to come in on night shift and I had to do this, and I'm just not doing super well today. And then we would leave the meeting with, okay, what do we all need to do so that so-and-so can go home and get some rest? And so the action items were about how to support each other first, and then the tasks actually were secondary.
Yeah, makes total sense. I'm curious to know if we can talk a little bit about your expertise in issues like mental health and childhood trauma, and perhaps some of the ways that I'll never forget it. It was a mentor when I trained on the East Coast. And he made this comment when he was providing some opening remarks for a speaker that was talking about childhood trauma and the impact on mental health in later life. And he said something like, and he made reference to the extent to which we were all traumatized to some extent early in life. And it was probably, if I put my Freudian hat on, there's probably a reason why it got my attention. Probably the whole audience, it got their attention too. But I guess the whole notion that, hey, that's a real true comment, right? But maybe even particularly for healthcare providers in terms of how that's been channeled into adaptive kinds of pursuits. But on the other hand, again, double-edged sword, how that can contribute to perhaps overreach in terms of people pleasing. It would be interesting. Could you comment on that?
Yeah. A small part of my practice, I actually do see clients with childhood trauma, in particular, people who grew up with a parent who had a mental illness or a substance abuse issue, because neglect and abuse can take many forms. And I think that as we grow up, some of these coping mechanisms that we have as kids just aren't serving us anymore. And on a personal note, that's also my recovery story. I was raised by a mother with narcissistic personality disorder, and I had to really unpack that. I remember reaching adulthood and going to college and being like, oh, this isn't how everybody was raised, and this isn't how everyone grew up, which was what's got me on my journey to going into psychology originally. But it's about finding out what those maladaptive coping mechanisms are and really unpacking that. So when I work with clients, yes, there's the leadership portion and there's the team environment, but also more often than not, there's also some personal growth and that needs to happen as we unpack some of these things and replace those maladaptive coping behaviors with ones that, are more positive and that, feed them and rejuvenate them. So that does happen as well.
Mm-hmm. Yeah, it stands to reason, I guess, if you think from a psychodynamic perspective, that perhaps part of the reason why people are unconsciously driven to become caregivers has to do with perhaps a similar kind of early life experience to one extent or another. As I certainly share that, and I know lots of colleagues who have similar stories. And when I think about my own experience, I remember having a traumatic situation when a grandparent passed away at home, and I was of the age where I had lifeguard training and I wasn't quite sure what to do. I did my best, but nature took its course, and so maybe part of that experience is what drove me towards geriatric healthcare. You never know. There's probably a part of it that was because of that. So I think everyone's probably I would expect that a lot of caregivers, healthcare workers, other sorts of caregiving professionals will have similar kinds of experiences. And of course, that can inspire them to be fantastic caregivers. But again, it's just a matter of figuring out when can that spill over and start to become unhealthy.
Absolutely. Yeah. And I'm sorry that happened to you. I just want to validate that's incredibly traumatic. And I understand how that could have affected you. But yeah, I think that's a lot of the people that I work with, they do have, like I said, like a character defect with massive that crosses the line. And it's also just the things that we're working with. It's just that it crosses the line somewhere. Or it's that, especially for leaders in healthcare, the people that I work with, they're so busy, they don't necessarily have time to unpack some of these psychological issues. They just put it in a suitcase, and then every once in a while the suitcase pops open because something else happens, or something happens at work, or something else happens in life, and they just shove it all back in and then never deal with it. And that has its own consequences in terms of affecting your daily mental health. So it's just going through life as we experience trauma, as we go through certain phases in our life, we have to reintegrate the trauma that we experienced and find out who we are in our new person with that trauma. It happens when we get into midlife. It happens when we have children. It happens when we get married. And people don't make time to reassimilate that trauma into what that means for us as this new person. But that definitely does happen. And that's a very common topic of conversation among my clients is, who am I and what does my past mean for me, and how can I unpeel that onion, but also do it in a way that's more positive so that I can move forward with my life. Mm-hmm. And because I'm doing coaching, it's more about, it's not necessarily therapy, it's more about moving towards the future instead of necessarily talking about the past, but it's how can we use this to propel ourselves forward in a more positive way.
Yeah, that makes a lot of sense. It's probably something that I imagine you find when working with leaders, that the more that perhaps they explore and are aware of their own issues around trauma-related experiences, that would be helpful to unpack and have a better understanding of how the psychologically mindedness that kind of helps them to understand as far as their own experiences might help them to then be attentive to, without being overly intrusive, but just attentive to team members in terms of saying, perhaps even internally, hey, I wonder if this person's had similar challenges or they're going through something, and maybe being a little bit more intuitive about how to address that in a delicate way than maybe they might have been before, doing the own work with their own experiences.
Yeah, absolutely. And I think, we've we've really grown, or at least I grew up in a time where leadership was really divorced from the emotional side. And I think we're seeing more servant leadership, more emotional intelligence training. And a lot of that is just that, just being in tune with the people around you and being there for them, regardless of what they come in with. My team always knew, even when I was an administrator in healthcare, they knew that I also had a PhD in psychology, and they knew that I was there for them at any time for any reason. And they'd walk in my office and they'd say, "Take your name tag off. I need Dr. Jess today." And I'm like, "Okay, perfect. I'm here for you." And I think that is such a gift that we can give to our employees, especially if we've had an experience that we can meet them where they're at on. And that's such a gift to them. But people are afraid of giving that gift because they don't want to be seen as an effective leader or sharing too much or disclosing too much. There's a rule in therapy. You disclose when you believe that it will be a benefit to the other person or a benefit to your client. And as long as I followed that rule, it really served me well in terms of talking with employees about things that I had experienced as well. Not to say that I ever overshared. I don't ever feel like I did, but it was just a way of connecting and saying, "Hey, I've been through similar experiences, and here's how it helped, me, and here's how I get through this situation that you're dealing with right now." I think it's really important to be humans again instead of just these robots that sit behind a desk.
Yeah, absolutely. It's the coaching aspect of leadership, right, as well, in terms of just being empathic and having a sense of, look, maybe I'm in charge here, but it's in a way we're all in charge. We're having that shared responsibility towards a common goal. And my job is as much as possible to support you as it is to perhaps be the leader in quotations, right?
Yeah. One of the things I used to say to my team was, or every time I hired a new director, I had a spiel that I would give, but one of them was, "Hey, we have different roles, but we're both adults, and we're equal in maturity, and we can be human beings and be here for each other. And here's what that looks like for me. What does that look like for you?" And actually have a conversation about what that relationship will look like when you're a servant leader. I think it's extremely important. And it's not just leading by example over time. Again, it's about not being afraid to have those conversations and really operationalize it, create that connection early on so that people don't learn it over time and maybe mislearn what you're actually trying to do.
Yeah. We've used the term servant leader quite a bit, and I think obviously it makes sense in terms of the things we're talking about with people in these leadership positions or caregivers, or honestly high functioning individuals in general, where there's this inclination to be hard workers and maybe overwork. Do you mind just providing a brief kind of definition or thumbnail sketch of what servant leadership is and how, what I understand it isn't? It doesn't mean to be sacrificing yourself, your life, your family to the interest of the environment, the team at work. It doesn't mean just like literally work at all costs and nothing else matters, obviously. Yeah, could you provide what your favorite definition is or concept of servant leadership is that has worked well for you in your practice?
Yeah. How I describe servant leadership is that we really are on an equal playing field. We just have different job responsibilities. And one of my responsibilities is to be in charge of certain things and approve certain things and be responsible for certain things. And that's really it. But beyond that, being a servant leader means I've got to walk the walk. I'm not going to ask you to do anything that I wouldn't do myself. I'm going to jump in and help. And my teams, it's more than just saying it, it's living it. My teams knew if we were down a cook, I'm going behind the line and I'm making eggs. If there was some kind of an emergency, my team knew I was there at 2:00. So it's not just paying lip service to some of those things, but it's actually showing up in a way that helps them and supports them. And that's what it means to me, is it's more of that action that they get to see, that you're supporting them in a really different way.
Yeah, I love that. It's having someone's back, right? And obviously that's going to build
Mhm.
trust. And the currency of trust is so important in any kind of organization, obviously. Little things like, again, I've navigated at times. And I honestly have a lot of forgiveness for the people that may have been involved with this kind of thing, because part of it is when there's a hierarchy in an organization, perhaps there's anxiety in terms of coming to somebody who's slightly above you. And again, in quotations, in the hierarchy with some kind of concern, and then leapfrogging to the higher with a complaint, and then you hear about
Mhm.
higher. So how that kind of dynamic can undermine trust and collegial kinds of interactions. But yeah, I love this description that you give of servant leadership as really having each other's backs and being as open and honest and genuine in terms of communications, positive or negative, as much as one can, right?
Yeah, and just to address your example, so I had a couple of ways that I talked about that calling your boss. I had a situation where I took over a team and they were so used to calling the regional for support instead because they were just without a director for so long. I instituted a couple of things and it was like, hey, you guys, like, I have a no surprises rule. And what that means is that things don't tend to fix themselves. And if I know about something, then I can better advocate for you. That's what I mean by no surprises. It's not a shame on you. You didn't tell me about this. It's more, no, this is what it really looks like in practice. And then the other thing that I said was like, look, you can call my boss anytime. That's totally fine. I have nothing to hide, but they're not going to fix your problem. I'm the one who's going to fix your problem. And so it's just talking about it in a way of like, all right, you want them to stop that behavior, but really explaining why and in a neutral way and saying why what they're doing or what they're practicing isn't effective. And once you tell them why, then in that neutral way, it just really takes the air out of that confrontation and that situation. And then they understand, oh, okay, that makes sense. Okay, we'll start calling you from now on. I'm like, hey, you can call her, but the regional's not going to fix your problem. She doesn't even live in the state.
Yeah.
I'm the one who's going to solve this for you. So let's do this together. So just wanted to share that piece.
Yeah, for sure. That's a great example. Thanks for that. And I also think that the person who was leapfrogged, so to speak, and is feeling upset about having been like talked about behind their back or what have you, or they complained to their boss from someone that they're managing, what have you, that gives an opportunity for that person to reflect on, hey, what is it about how I'm acting or my style of management that maybe created some anxiety in that person in not wanting to talk to me first. So then there can be some debriefing around, okay, maybe I need to be looking at ways to make myself more available or perhaps less intimidating as someone to approach with a challenging discussion.
Yeah, absolutely. And there is something to that. You definitely want to be self-aware enough as a leader to say, all right, there's something about the way that I'm coming across that is making this other person uncomfortable. And that's not what we want. We're really having a conversation with that employee or that staff member about, hey, what's this about? Let's just have let's have a name tag off conversation and let's just talk about, I don't want you to feel that way. I don't want you to feel like you can't come to me. I don't want you to feel uncomfortable around me or anybody else. What can we do to solve this? There's so much power in having those conversations, and that's a very powerful position for a leader to have that humility and vulnerability to have those conversations. I certainly had them with my employees, all the way down to line staff.
Yeah, for sure. Yeah, no, I like those. I like the concept of humility and vulnerability because, again, it builds trust. And yeah, there's a sense when there's authenticity and trust, and people can understand that on that human level, as you say. I like the concept of name tags off discussions, right? It being, yeah, I really appreciate hearing that. I think that for viewers and listeners, I think we're just getting so many rich suggestions on how to be healthy and mindful in implementing emotionally intelligent strategies to foster leadership, whether it's healthcare or frankly, any kind of leadership endeavor. We talked a bit about self-care, and just as we kind of work towards a close here, I'm just curious, in your experience, self-care, it's maybe, I don't want to say, I hesitate to say that it's overused because I think it's really important as a concept, but you do hear a lot about it these days. What would you say about self-care, self-compassion in terms of the role that you've seen it playing in high-performing leaders who have been able to maintain a sense of self-care, self-compassion, and translate that into success in leadership roles?
Yeah, that's a good question. I think that it's really about boundaries and knowing where those boundaries are and holding them so that you're really controlling your energy so that when a emergency does happen, you have some gas in the tank in order to deal with that. So I think the leaders that I always really looked up to and who I learned a lot of these skills from, they were people who really did have those boundaries and had those boundaries around work and hours and energy and I came in early, so I'm gonna leave early today. And you know what, guys, I'm gonna be in a movie for 3 hours on Saturday. If you need anything, you need to call this person. Just prep your people so that they know what those boundaries are and then they know the difference between what an actual interruption looks like versus what actually looks like, versus just making it part of your daily existence where you're just open 24/7, like a gas station. And we don't want that either, because that's when we lose that energy and we're crossing that line into burnout. So I think that it's just really important for people to be aware of what those boundaries are for them, set them, stick to them, and then that way when emergencies do come up, it's okay because you have energy to do it.
Yeah, that's great. I love it. I think that makes so much sense. Yeah, I guess maybe in closing, if there's a message or a certain kind of words of wisdom that you feel that based on what we've been talking about, that you'd be able to leave us with in terms of leadership, mental health, all of the kinds of things we've been talking about, what would be some? We've talked a lot about these topics, like you've just mentioned, the importance of boundaries as far as self-care, self-compassion. Is there anything else that you thought would be interesting to comment on just before we wrap up?
Yeah, I would just really to punctuate, like really rest, really recover, and do more of it. I think we can all do more of that. All of the things that nourish us so that we can be more present when we are at work.
Yeah, I think, I really appreciate that. And putting structure around that as well, whether it's Sundays, if that's something that fits into your particular worldview, or taking a certain other day of the week, depending on your schedule, or even a half day a week, or certain evenings every week, and just blocking them off and saying, look, this is the evening that I'm going to focus in on my hobby and organize, whether it's doing it in your studio at home, if you have that, or going to a community center or whatever. It's just having it so that there's time protected for you, and so that you can retain, keep that gas in the tank, as you say, right?
Absolutely. Yeah, I do that for myself. I block out personal time in my calendar so I don't get too overwhelmed. I block in breaks. I track things and I've got like my little 90-day planner, and I track my habits. And because there's a lot of research around, if you track those things, if you actually block out that time, then you're actually going to hold yourself accountable.
Yeah, no, I like that too. Or maybe even just teaming up with a buddy and just making it so that you have some shared accountability can be a little strategy that can help also.
Absolutely. Yeah.
Great, super. Maybe for viewers and listeners, where can people find your content, Dr. Tighe, your links? We'll put links to all of this in the show notes for people to please check out. I'd really encourage you. But yeah, where can people find you online, social media, and that kind of thing?
Yes, my website is Solutions for Health, SOULFOR, health.com. So you can find me on there. You can schedule free consultations from there. The social media I'm most active on is LinkedIn. That's where I write a lot of posts and articles and lots of fun tips and tricks. So you can find me on there as well and chat with me and message me. And I'm also on Facebook and Instagram, although not as much. So find me on LinkedIn.
Awesome. That's great. Yeah, again, I encourage everyone to check out Dr. Tighe's content and certainly reach out to her. And I would encourage you to book an appointment and just get access to her expertise when it comes to coaching, leadership, mental health, all the things we've been talking about today. Dr. Tighe, thanks again for joining us, and just wish you all the best.
Thank you so much for having me. It was great.
Okay, take care. Bye for now.
Thank you.
Thank you so much for joining us today on the Neurostimulation Podcast. I hope that you enjoyed this discussion as much as I did. I think that there were so many interesting points that were raised and actionable items to help with stress management, self-care, leadership, team management, and improving effectiveness and efficiency in organizational kinds of environments. If you found today's episode interesting and helpful, please subscribe to the podcast. It's the best way to make sure that you never miss an episode, and it helps us to reach more curious minds like yours. If you think today's episode might resonate with a friend, a family member, or a colleague, please share it with them. This kind of knowledge is better when it's shared, and you never know who might find this information helpful or inspiring. For more details about Dr. Tighe's content and offerings, please check out the links to her website and other information that are included in the show notes below. Please also comment or ask questions, join the conversation, reach out on social media. Your questions, ideas, and feedback make this podcast better. Finally, don't forget to tune in to the next episode. It's going to be another exciting journey into the cutting edge of neuroscience. So thanks again for watching and listening. Take care, and I'll see you next time on the Neurostimulation Podcast.